This is a lady I had operated almost 7 years ago for a coloboma of the lens with a significant cataract, and she presented in my OPD 7 years later with an inferior subluxation of the lens, significant pseudophacodonosis, capsular phimosis, for which already a YAG capsulotomy was done, anti-YAG capsulotomy relaxing incisions were done. Now I have planned to stabilize this lens with the anchor suture to the sclera. Mind you, the vision with correction is 6/6, but she is symptomatic, fairly symptomatic, and I have decided to go ahead and fix this lens. So after doing the peritomy, I am measuring about 1.5 millimeters from the limbus. Although I marked it with the calipers, I make sure I mark it with the gentian violet pen as well. I then go 0.5 millimeters below and make a lamellar incision with my crescent blade. 15 blade and crescent blade. Then opposite that central area, that's at 1 o'clock, almost 7 o'clock, I put in one paracentesis incision, and I put one paracentesis incision at the side as well for any other maneuvers that I may do. So I am filling up the chamber with viscoelastic, just enough to give an AC fill, replace the aqueous, not to push down the lens as such. Take a 26 gauge needle, go into that lamellar incision, puncture at the 1.5 area, go posteriorly and then go down, and I am going under that capsular tension ring behind the posterior capsule. And from the other side, and this can be tricky because you're using both your hands and you just cannot let go. I am coming with this is a 10-0 Prolene suture. I should have had a 9-0, but anyway, this is what I have. It's a curved needle. That lens is it's almost a dancing bag complex, and you will see it even more once I pull this through. I have railroaded it into the 26 gauge needle. Pulling it out, there is a bit of a bleed, obviously mild iridiolysis has occurred, and then I pull this out. Just watch that lens, how it is moving. And then I go again with the 26 gauge needle on the other side of that mark, so it's around 1 millimeter away to the original thing. Again go, and this time I am going to come out anterior to that lens bag complex, and it is difficult because it's engaging the iris. So I go through the side port, pick up this iris to move it out of the way, bring the 26 gauge anteriorly over the complex. You should not go through the bag again, and be very careful when you are threading the needle through the paracentesis. Do not go through any tissue. So once again I am railroading, and again the same problem. Anyway, that's done. So now I will pull these both ends. It is hooked around the CTR, and you can see as I pull, the whole bag complex comes up, and it's very important to center this lens and then tie off the knot. And I have tied 4 knots are enough, but I have made 6 knots, and it is well within the lamellar incision. You got to center those Purkinje images, and once I have done all the knots, I cut off the Prolene suture very carefully, taking care not to cut the knot. I then cut the suture the conjunctiva as well. And here I am cutting off that, because I have pulled up the lens. I am little worried that this opacified area will come in the way, so I am cutting that off with my micro scissors. And that bit I just pull off with my hydrodissection cannula. Remove the HPMC, put in some pylo, put in some antibiotic as well, intraocular antibiotic, and that is the post-op day 1 picture. The vision is 6/9 uncorrected. but we have to see on further follow-up what other problems she comes up with. Thank you so much for watching.